End of my week. I haven't seen anything yet. There we are. We're live.
All right. Good. All right. We'll give everybody a couple of minutes. We're still a little bit early. So Chief, tell me about how far you've dug into streaming services. There's a rumor that you've gone right past Disney Plus and are now into Nat Geo. Is that true?
I did. I watched a few episodes of Bear Grylls taking celebrities out for survival lessons, and I watched an 8-part series on Australian cricket this weekend as well.
8 parts.
Yeah, yes.
Were those half-hour parts or hour-long parts, or?
They were like 45 minutes to an hour each. So I know a lot more about cricket than I ever knew before, which was nothing before. But I enjoyed that it was really leadership, like how you saw the coach take a group, and it's a national team, so they're always putting players in and taking players out, and how he was building camaraderie amongst the team, and they also had a cheating scandal they had to overcome and all kinds of stuff. So I enjoyed the personal aspect and the leadership aspect of that series.
Okay.
So it hooked me.
Yeah.
How about you?
What did we? Well, I've gone back and started to watch Sopranos again from a long time ago.
Yeah. Does it hold up?
Yeah, it holds up pretty good.
Yeah.
A little dated,
but
it holds up pretty good. So I watched a little bit of that. I think we're caught up on Tiger King.
Okay.
So I'm good on that.
Yeah, I haven't watched that.
You haven't watched that?
No. Like half of an episode, and then I was like,
How can you be so deep into Nat Geo but not
not watch Tiger King? Yeah, wow. I don't know.
Huh. Well, it's like I don't even know you. I gotta say, I'm a little disappointed.
I was more
now.
interested in Rob Riggle trying to go across a glacier.
Yeah, that was pretty good. You were telling me he was a Marine. I didn't know that. Yeah, that's interesting.
Retired as a lieutenant colonel.
Yeah.
Marine Reserves.
Hey, so you sent me a note over the weekend on Sunday.
Yeah.
About, I think it was Sunday morning, about how this is starting to get old.
Yes.
Not sure that was your exact words.
Yeah.
Something along those lines.
Yeah.
So what do you think? What do you think happened this weekend? What were you feeling?
I felt like we've kind of settled in to a battle rhythm, and now where I thought there was a lot of hustle and bustle the first few weeks as we've done this, now we've kind of settled into a battle rhythm, and now I think now I'm bored, I guess you would say, on the weekends, where I'm used to going out and doing different things, and just being active, and I do my at-home workout, and I walk the dogs, and now what?
Yeah.
Yeah.
This has been an interesting challenge. I think not just to be in a position like we're in, but I think for our entire force.
Yeah.
Because we're wired we run to the fire.
Right.
We're designed to help. We're designed to accomplish. And in this fight, we're asking some folks. We're telling some folks the best thing you can do to help is to not do anything.
Right.
Meanwhile, I'm asking a lot of folks, to put themselves potentially at risk, greater risk than they are maybe day to day. Those are wide areas of the spectrum, and I don't know that I've ever kind of experienced anything like that. I mean, I guess in a deployed environment, you have folks that are supporting, the main operating base, and you have folks that go forward out of that. So I guess maybe there's some parallel there. But in a deployed environment, you don't have the families quite as attached as you do, right? Because there's geographic separation there. Mm-hmm. Even though I would argue that commanders are the same risks that our families are facing with the pandemic are the same risks they face when they're active duty members downrange or guard or reserve, whatever it happens to be. So I think it's just been an interesting time,
right?
To try to figure it out. I don't know that I've felt bored. I felt like, what should I be doing? Right?
We've had that a lot too.
Yeah.
Yes.
It feels like I should be doing something right here. Mm-hmm. Where sometimes the best thing we can do, I think, is as a leadership team is maybe not do anything. There's moments, right, where there's too much. So that's, I don't know. I've been thinking a lot about that, and your text on Sunday got my attention, because it does feel a little, 3 or 4 weeks into this now, depending on where you live and what the rules are. I think it's starting to wear on a lot of folks, not just us. So I thought that was pretty timely.
Yes, sir.
Yeah. Yep.
All right. You want to?
Yeah, let's get into it.
All right.
Well, I'll start with kind of where we're at,
Yes, sir.
and if there's any updates that we need to kind of get out to the public, kind of big picture. And the truth is, there's really not a lot of changes from last Tuesday to today. We made mention last week about closing Virginia Gate down. That went off without a hitch. I know there's some folks that are disappointed that they can't run out the back gate to shoppers and those kinds of things, but appreciate everybody's understanding on that, and no mission impact from that I'm aware of. We changed the VCC hours a little bit, just based on business, and based on, again, reducing some risk to the folks that are in there. And that seems to have gone pretty smoothly. I haven't gotten a whole lot of feedback otherwise on that. And then we adjusted the child care centers, child development centers a little bit, just so that we have more flexibility on the off chance that we have a positive in there at some point down the road. We want to be able to flex between facilities and between staff easier than we had been set up to do before. So we altered that a little bit. I forgot to mention last week the credit union was closed. The week prior, we had put out a PA announcement about that, based on not a COVID positive in the credit union, but an employee that was that lived with someone that was positive. The employee's doing fine. I did check on that this morning, but the credit union, not just at Andrews, but across their facilities, they've gone to appointments only in the lobby, as I understand it. Mm-hmm. So that didn't really open up like maybe some folks expected it to.
Right.
But from a kind of a base or a health point of view, it's all good news out of the credit union there. So and then across the wing, we continue to get some folks into the ECC, our beneficiaries. We've had additional positive that report to the county and to the DOD, and they report those numbers. But it seems like a lot of the things are working. It seems like social distancing is working. It seems like the measures we've taken to kind of do alternate work schedules and teleworking has been really effective. When I look at kind of our numbers compared to the general population, or at least in the National Capital Region, I'm pretty pleased with where we've come from. So that's kudos to everybody else. That's not us. I've said from the beginning, this is a community effort. It's not a wing effort or an installation effort. We can provide some guidelines, but ultimately it's up to folks to follow the rules. And I think for the most part, I said last week, the Surgeon General of the United States says 90% are doing the right thing. I think we're probably about that on the base, so that's pretty good. So appreciate all the help from everybody to make sure that we're doing what we need to do.
All right, sir. That's a good state of affairs, and that was the first question. The second question is, have you resolved the mask supply issue?
So I'm not sure what the mask supply issue is.
Right. I know a lot of people are doing different things.
Yeah. So we really kind of turned that loose onto the individual units, the individual wings on the base. And so last week I brought the handmade one that I had done because the guidance had come out so quick. This week I've got two. I've got the one that was printed in the lab. And then I borrowed one that the 89th had done because I thought theirs turned out really nice, and they used some of their contractors to do that. And so I've seen that across the installation. And then I asked, you and I both asked the other week or the other day, is there anybody coming to work that we're asking to come to work that doesn't have one? And the answer we got back was no, everybody is good. That doesn't mean it's perfect. So we've probably ordered several thousand of them this week because the Air Force set up a blanket purchase agreement for us to go get a little more standardized product. So we've executed that, and I think we're in pretty good shape on masks overall. That doesn't mean that somebody's not still walking around with a handcrafted one, but that honestly might be what they prefer versus what we can issue. But I'm not if there's other issues out there, I'm not aware of them. And if somebody can highlight if there's a unit or there's a specific airman or an employee that doesn't have what they need, highlight that to us so we can figure it out. But across the installation, I have not heard many issues with that.
Yeah, we've been fighting for feedback on that and haven't heard too much back.
Yeah.
But
the one area that we did ask for some help, and I'm still a little nervous about, is the community part of it. Just those folks, when they come into the commissary, when the commissary mandated on Friday morning that everybody come in with a face mask, then they walked that back a little bit to give folks some time, so they started instituting that on Monday. I'm just worried that the folks in our community, not the ones that work on the base, but the ones that come on the base to take advantage of their benefits, I don't want somebody turned around because they don't have a mask. So you'll see there's a couple of boxes out there at the BX in the commissary. And the idea behind that was not for our airmen. Our airmen are fine. We're good. But the idea behind that was, if there's someone in the community making them that's got extras, they want to toss them in the box, then somebody in the community can grab that as well. I know the messaging got a little confused on that. And,
yeah.
But that was the intent.
That was my fault. So sorry for that.
Yeah, apology accepted.
Yeah.
Yeah, we'll take that. Yeah.
All right. So, yes, you answered that question. Okay. Has anyone suggested using 3D printers at the community commons to produce the plastic pieces used for tightening face masks behind the neck and the plastic headbands used for making face shields?
Yep. So that's an excellent question. And so some of you saw a little story that was put out. Well, not a little story, good story, big story. And, we had SimSAF over there. Chief Wright came over and spent some time with the airmen. And I don't think what quite did it justice. There's one picture of me kind of looking at a table. And all that on that table are a variety of prototypes, but also the plastic the parts to make face shields. So you print out the plastic piece that goes around your head, and then you can use just about any piece of plastic to be a shield. And a lot of the healthcare workers have been asking for those so that they can save the mask that they're actually using, the N95 mask. And so we have made some of those. Not a lot. We haven't had a big request for them, but we have some of those. The other one about the bands that make the face mask more comfortable, they absolutely have printed off some of those, and they've made those available. Not a large number again, but I checked with the med group this morning, which is the group that we probably had the biggest need for that right off the bat, and they have them. They have the plastic bands that make those masks a little more comfortable. So we've made some. We have plenty in stock for our medical providers to make that a little more comfortable. And I even Kelly went to work this morning. Nurse Kelly, and she grabbed one of my blousing straps that I use on your OCPs or APUs, and she grabbed that and took it to work. So she's got her mask with a blousing strap because it's more comfortable than going around the ears. So that was a solution out there. So yeah, there's a lot of they are tinkering with just about everything over at the Spark XL to figure out what works best and where the need is. And part of the story was I've had my face scan, Chief had his, Chief Wright had his, and they're in the demo phase, in the prototyping phase. So they've done a handful of those. They used us as crash test dummies on some of that, which is that's a good role for us. And as they refine that design, we're trying to get those different requirements in different places. So the scan your face, the self-fitting mask, that is really trying to get close to a replacement for N95 medical grade. That is far different than what we've asked airmen to do with the cloth masks. So we're trying to figure out, okay, where do we have maybe the most risk and exposure, where we don't have a lot of supply of things like those N95 masks, where the 3D printing can come into play and fill a need. So it's not universal. It was never meant to be, because it takes about 6 hours to print one off. So there's a limited capacity. But where it makes sense, we'll do that. If we have a need, or there's a need, that's brought forward for fitted, more medical grade things, we can do that in the 3D lab. If it's just cloth face masks, to be compliant with the Secretary's guidance, we have another, capability. We have capability all around the wing to do that. And then, like I said, we've ordered quite a few as well.
Yes, sir. The next question kind of covered all that. The one thing that that is interesting about the Innovation Center is you saw the masks on the table, but they actually have bins of all the things that didn't work.
Yep.
Right, and that so they're going to melt that down and use the process. But there's a lot of failure when you're innovating and you're trying to make things for the first time, and so those airmen are not discouraged by they're more actually invigorated by this didn't work or the machine didn't do this, so they're making tweaks as they go along.
Yeah.
So I think it's awesome to see that over there.
And you've seen that across the. I mean, I have to give a shout out to the Honor Guard. There was an image that went around and it even made the evening news of our honor guardsmen after the Secretary's guidance. Mm-hmm. They had created, a cloth face mask for them to wear while they're doing, funeral ceremonies and honoring the folks that we need to honor, because that continues right now. And they had the first design on Monday, which I thought was appropriate and unified and didn't take away from the ceremony. Changed it a little bit, but didn't take away. By Wednesday, they had blue. I mean, they are really sharp looking. So I've seen that across the installation, not just the 11th Wing, but across the installation. This has been not a huge issue for us to tackle.
All right, sir. Next question is about the dorms. Is anyone doing morale checks of airmen in the dorms? Do they have free access to Wi-Fi? And are there day rooms to drop off goodies or even drop off weights or mats for them to use? Just a suggestion is what they put out there.
So you can answer that one, Chief.
So our leaders are, we have about 300 dorm residents. 70 of those are sailors. And so our leadership teams are very engaged with their airmen in the dorms. Our first sergeants even partnered with the chapel on Friday, and they did a DoorDash. And they brought free meals to everybody in the dorms, and I think they did it through Chick-fil-A, and I know they're working to do that weekly. So there's a lot of that going on. As far as we do not have a drop-off place over there right now for anybody to bring anything from the outside. I think we're a little worried about making sure that our airmen are safe over there, and we don't want just a bunch of stuff to show up and people start picking through it and then have an influx of folks over in that area. But if you do have things that you want to get to airmen in the dorms, please contact, if you want to get to the sailors, please reach out to the Naval District of Washington. And if you want to reach or go to a specific unit, reach out to the first sergeant, and then they can work out a plan to get things to their airmen. So please don't go over to the dorms, but reach out to unit leadership teams to provide a mechanism to get those things to them. Anything else on that, sir?
The only thing I would add is, a lot of those airmen that are in the dorms, those are the ones that are still coming to work every day, right? So they just happen to be in some of our most critical functions. I have a large group of med folks over there. I have a lot of my command post controllers that are still coming to work every day are in there. A lot of my young CE airmen that are doing maintenance around the base to make sure the base continues to function. So the dorms are still a pretty darn busy place because we've asked a lot of those airmen. And so we're getting eyes on them, whether they're in the dorms or they're in the work centers, we've got good eyes on them and looking out. But it's, admittedly, this is a little bit of a challenge. Right. And so we're working through that.
Yes, sir. All right. The next question. These are AFI's commissary questions.
Okay.
All right. If we go to the commissary, are we able to take our small kids? My husband is essential, and I have had to take my 2 9-year-olds with me. They were told they couldn't come in because they didn't have ID cards and were required to.
So I'm not aware of any policy that at the commissary that would turn your 9-year-olds around. But I would need to know some more details about this particular instance. You're
supposed to be 10 to have an ID card. Yeah. Maybe they thought they were 10 and needed to have ID cards to come in.
Yeah.
Maybe something like that.
And if it were Friday morning, there were a couple hours where there were folks that were being turned around without a mask until we adjusted the site picture on that. So I don't know if it was an ID card or a mask issue. I'd really have to nug into it. But as a policy, I'm not aware that the commissary is restricting access. I will throw out that that's one of the reasons why we have the active duty hours, is because we know there might not be an opportunity for folks to leave kids with somebody else, or they're not, where they get their child care isn't open. So we knew that our active duty families would be bringing kids with during those first couple hours. That was one of the intents of why we set it up, why we did. So understand that. But I will encourage you, because they're limiting to 100 people at a time in the commissary. If there is a way, to get to yes on maybe not bringing the kids, I would ask you to try to do that, understanding that's not universally possible, because the kids will count toward the 100 people, and that just means a little more time for everybody else to wait in line. So that would be my ask. But totally no issue at all with bringing the kids that I'm aware of. If that's what you need to do to make sure you got the supplies you need.
All right, next question is, currently only DECA has mandated face coverings inside of their stores. The exchange expects shoppers to adhere to Department of Defense and installation requirements regarding face coverings. Will you make it mandatory for all JBA Exchange customers and employees to wear face coverings?
So that's a great question, because I was a little surprised at how fast the commissary went ahead and put out their guidance, and I think it caught us all a little off guard, because they kind of blasted it out in a press release, and then we reacted to it. AAFES has not followed suit to the point of the question. So I checked with Thea, our general manager, this morning, just to make sure that I understood their guidance, and they still have not provided mandatory guidance in their stores. So here's what we're going to do. I think to level the bubbles between the facilities on the base, and quite honestly to make it easier on the community so we don't have two standards, I'll push out a memo later today that directs the patrons of the commissary, of the AAFES facilities, and of the shopette to have the cloth face masks. And again, it's a community policing effort. I'm not looking for Thea and her folks to be out there, turning people around, until folks have had a chance to adapt. But I think we do need to kind of level that so there's an expectation when you come onto the base. And at the commissary, it was a little bit of an issue on Friday. I've not heard of it being an issue in any significant way since then. So I suspect at the BX facilities it'll be the same. There'll be a day or so where folks will go, well, I didn't know I had to do that, and then after that it'll kind of solve itself. I did, I acknowledge and mentioned to Thea that they've put the face guards up at the registers. I'm okay with that being a face covering for folks that are working the registers, so they don't have to have the masks on for hours at a time. And then she's got folks in stock rooms that aren't around anybody. I'm not overly concerned that they have the masks. It's more that interaction piece out kind of in the store areas and the mall areas that I'm interested in. We had one incident on Friday morning at the commissary. And Prince George's County is going to make cloth face masks mandatory on Wednesday. County Executive Alsobrooks put that guidance out, and that's going to be mandatory in their grocery stores, in their pharmacies, and on their transportation, on the bus system. So I'm going to say right flat out, if you're coming on to Joint Base Andrews and you don't have a cloth face mask, you're wrong. That's it. And folks that are standing in line, at the commissary or going to the BX that think they can social distance in those facilities, that's a joke. And you're not doing your part. So when you come onto this base, have a cloth face mask. That's the Secretary's guidance. That's the Air Force guidance. That's the installation guidance. If you can maintain social distancing and you don't have to put it on, that's great, but it ought to be in your hand at this point. And I hope everybody gets the message on that.
Yes, sir. All right. Here's a question here it says, with Prince George's County having the most cases in Maryland of COVID-19, why haven't we restricted access to mission essential personnel, those living on base?
Yeah, so that's a great question. And we've tackled this a couple times over the last month. I think what's different now is there's more data, right? There's more data out there. So here's kind of some things to keep in mind. So the top three counties in Maryland right now for positive COVID are Prince George's, Montgomery, and Baltimore County. They're also the three most populous counties in the state of Maryland. Prince George's County just has right under 1 million a million folks. Montgomery County, I think, has just over a million folks. So a little bit of difference, but not a lot. So when you look at the percentage of the population that has been tested in those counties versus the number of positives, we're talking very, very, very small numbers. So I did some back of the napkin math this morning on Prince George's County. I believe we're at 0.02%. No, 0.2%. I'm sorry, 0.2% of the population. 0.2%. If we're social distancing, if we're following all the guidelines, I don't believe that 0.2% of the population is necessarily a driver to shut the base down. And it's important to me because I have a population here in Prince George's County that uses the base. They use the commissary, they use the exchange, they especially use the med group for their prescriptions. And I think so long as we're doing all the right things, I think we've reduced that risk to an acceptable level here on the installation. And I've kind of seen that play out with what has occurred on the installation as far as our positives go. And then I think you got to be a little careful. So I started to, because I thought it was a curious question, I started to look at some of the other counties where a lot of our workforce lives. And while Prince George's County might be at 0.2, I can tell you that Fairfax County, by the numbers I did, was at about 0.16. Calvert County, about 0.18, roughly. So I don't, even though the numerator for Prince George's County is larger than other counties in Maryland, I'm not sure the percentage is that much different than other counties in Maryland. So I think you got to be a little careful. And then I take into account where the workforce of the base lives. I'm not, if I lock the base down, who am I locking down? I'm certainly not going to bring everybody onto the base because that's counter to what we've been trying to do to keep folks healthy. So if I've got someone that lives in, Fairfax, and let's say a week from now, because Virginia looks like they might peak a little bit after Maryland based on modeling data, do I say, well, no, if you're not, everybody from Fairfax, you all can't come to the base. I just think that's an unexecutable plan. So I'm not really looking at going down that road. And then bigger picture for our community, right? We're part of this. We're part of the base. We're part of Prince George's County. We're part of the National Capital Region. Be very leery about going down the road of, which street has more cases than this street. This is not New York City. It's certainly a large metropolitan area, but it's not New York City. And we don't live vertically here. So I get really nervous when I see things talking about this street, has this, and we're not going to let those folks do X, Y, or Z. I've seen some black and white Twilight Zone episodes that I watch on New Year's Day that drives my family crazy, that look a lot like some of the conversations I'm hearing. And I would just encourage us not to go down that road. Overall across the country, and I do not want to diminish, there are people that are hurting today because they've lost loved ones and they've lost family members. And it has impacted the country in a fundamental way. So there is a lot of pain out there. But when you look at the numbers and you take a step back, we're still talking about very small percentages of the population. And that's a credit to everybody that's followed CDC advice and has kind of, contained this from increasing exponentially. Last week I talked about Prince George's County had been hovering around 400 cases for 3 or 4 days. They had a spike on one day, about 1,100, or the state of Maryland, not the county. They had a spike on one day because of some backlog in testing, and then went to about 700 cases for 2 days, and then today they were about 500 cases. So again, I'm not a math person, but we haven't seen the exponential explosive growth that some folks predicted. And I think that speaks to the things that have been put in place. And it's not the base doing that. It's the state and the county, and not just Maryland. It's Virginia. I mean, they've taken some steps. So that was too long of an answer, but I really do get nervous when we start talking about pockets of people in a region that's as complex as ours.
Right. Yes, sir. Next question is, why don't we allow limited access to the base gyms?
It's not time to have that conversation yet.
Yes, sir.
It's just not. It's not time. And we're talking about what that looks like. When we start to come out of this, and we will. What does that look like, and how do things change, and what can we start to open up, slowly over time. You and I have talked about, is there a way to get to, social distance golf? Right. Probably. I'm just not sure this is the week. Next week might be the week. This week's not the week to have that conversation. When we get guidance on how the summer PCS cycle is going to look and what the direction is on that, I think there's going to be a bow wave at things like the MPF and TMO. So I need that. I might need that workforce to come in before some of the other functions on the base. Right. So how do we kind of step through that and work some things in reverse? The Med Group commander and I just had a conversation about, where do you start to open up the spigot on routine care again? Where do you back off some of the things, they've done over there? So we're having those conversations. I think those are end of this week, early next week conversations, if things continue the way they are. But the gym, I'll be real honest, that's not high on my list. Because, it's tough to police. It's tough to enforce. We saw that with the fit boxes. Where I don't know why there was this desire to take your shirt off when you went to work out at the fit boxes, but that was counter to everything. Right. Here, spot me with my shirt off. All right. Well, we'll put orange fencing around it because we just can't pull that off. So we absolutely want to get things rolling again, and we'll figure out how to get there. I think there's a scenario where we start to open things up, but you still have to wear the face mask. I actually think that's a pretty plausible scenario. So we might open things up, but it might not look quite the same like it did, in February. So there's some work to do there, but we're not quite at that point in the conversation yet.
Here's another question. I think we've gotten this before. I think Colonel Smith was here, but let me ask this again then.
Okay.
Why doesn't the ECC provide medication after hours and on the weekend?
Yeah, they just don't. So they have emergency medication. So when you're seen in the ECC, they have the emergency medication they give you in the ECC. You'll walk out with a prescription, and on the weekends, that just needs to be filled at an off-base provider. And I know that potentially creates a copay, but it's not something that we're staffed and set up to do to support pharmacy ops on the weekend.
All right. Next question. The commander at Walter Reed has been conducting weekly Facebook events. Why doesn't the Med Group at JBA do the same?
Well, Walter Reed's a little different than we are, so I'm not exactly sure who's doing the Facebook Lives, but
they're a hospital.
They are a hospital.
Right.
We are a joint base with a clinic.
Right.
So there's a little bit of a difference there, and Vito's been working pretty hard. So I hate to take him away for anything that he doesn't necessarily need to be here at. And then I don't know that Vito would be very excited about giving medical advice and opinions in this forum anyway. So Vito's pretty important to the operation. Everybody over at the Med Group is. So they've been teleworking. They've been alternating their shifts so that they don't, if they have a positive over there, they can still continue to provide care. I'm not going to look for Vito to do that. Not here.
Yes, sir. All right. Last of the beforehand questions here. Will LRS be supplying masks to squadrons? If so, who will get masks first?
So I go back to kind of where we started with the mask. I'm not aware of any person we've asked to work on the base that does not have a cloth face mask to be in compliance with the Secretary of Defensive guidance. If that's not the case, I need somebody to tell me that. But we have ordered, again, through squadrons primarily, because each squadron has a different little requirement. Each squadron might want a different color, all those kind of things. We've very much handled that at the squadron level across the installation. But again, if there's someone coming to work that is supposed to have a cloth face mask that doesn't, we can work that. I'm not aware of that being an issue across the wing. It certainly hasn't come up to our level.
All right, sir. Now here's the live questions.
Okay.
Kyle Barber asks, Well, people arriving home from deployment, if that happens soon, be quarantined when arriving to home station, and will this affect their R&R?
I don't have a good answer for that because I think we're waiting on guidance. I can tell you what the level 2 and 3 guidance was before,
right?
Kind of the stop movement, and depending on where that deployment was, there might be a requirement for them to quarantine.
Right.
I don't know what that'll look like once we start moving again, and I won't say it for I don't have any guidance. It's tough to me to envision a scenario where folks don't get their R&R.
Right. Your 14 days quarantine is not going to count as your 14 days R&R from a deployment. It's not going to. Right. That guidance is out there.
Yeah.
All right. Oh. You answered that. Yeah. Oh, here we go. Chris Sprayer asks, I realize this is a low priority. However, with Virginia Gate closed, would it be possible to put the light to a 4-way?
Well, I mentioned that to you when we were driving the other day, and I never followed up on it.
Like where it's just flashing red?
Sure, I'll ask the question.
Okay. Yeah.
But I'll be honest with the community. So I asked the light out here at the main gate, about a year into my command, I asked to get rid of the 4-way stop because I've been almost hit too many times on the weekends. And the MSG at the time had a very violent reaction because I guess the previous couple commanders ago made them flip it to 4-way stop. And so I've sort of given up on some of that. But there's a habit pattern problem out here on the weekends, with especially the group that's coming onto the base to use some of the facilities. They expect to see a regular stoplight, and when that flashes, I think it's a little dangerous. We've had one bad accident since I've been here, but we've also had them when the lights have been, set to normal. So I will ask the question and see how hard that'll be to flip it over to 4-way stop.
Yes, sir. And that's it for today.
Okay.
Yeah.
Yeah. So again, we'll be back here a week from now. I think it's a positive sign that either folks are getting really tired of us or folks have kind of gotten a lot of their questions answered. So the duration of these is decreasing over time. But again, I mentioned it before. Don't feel like you got to wait for Facebook. If there's an issue that needs to be addressed, you can always bring it up to us. You can always call the front office up here, and we'll get you an answer. And get folks in touch with who they need to be in touch. But again, this is a hard week for a lot of our fellow Americans. It has been. The weekend in particular up in New York was hard, and we're starting to see some of the images come out from that, and we're starting to see tough decisions made. So never want to discount the incredible work that's going on, and the sacrifices that people are making, and the pain, quite honestly, that some of our fellow Americans, their families are feeling right now. But I could not be any prouder of what's happened here at Joint Base Andrews. The airmen, the folks that work here, the folks that shop here, the folks that, it's just been a joy and a privilege to watch this kind of unfold. It's funny, I mentioned to Chief, a couple folks have apologized that the end of our time is like this. Mm-hmm. And I don't think like that at all. This is when we rise up. This is the good times. This is where you lead through adversity, where you let those around you support you. It's just been an absolute privilege and an honor for me, and it's only been highlighted in these last few weeks. I don't view it as a burden or a negative to our time here. So I hope that message is getting through, because we've got a lot of amazing things going on in a time of great difficulty. So could not be any prouder of our community.
Yes, sir.
All right, Chief, anything else?
No, I never wanted to piggyback, and so I'm not going to piggyback up anything you said, because I was going to talk about pride and that, but I'll leave that there.
Well, isn't that how you start emails? Like
Yeah.
the commander said?
Yes.
Yeah, don't start emails like that. It's bad. Okay, we'll see everybody in a week.
Yes, sir.